Good afternoon. Today I'll be talking about online behavioral patterns in a health crisis setting, the 2009 pandemic, and this is a thesis by Claudia Vieira. So, when you look at the motivation, we see that infectious diseases pose a big risk to human populations all over the world. So it's very important for us to try to predict or detect as early as possible its outbreaks, so we can either limit or even stop them. The public plays a very crucial role in spreading the diseases, so it's very important to monitor their behavior as part of any surveillance system. In this digital era, that should be fairly simple because we have access to a lot of information. That has been done before with Google Flu Trends, so they try to predict the timing and the magnitude of the influenza activity by aggregating all the flu-related search trends and then providing reports in real time. However, they greatly failed in 2009 with the flu pandemic, and that made people that were already a bit skeptic about these kind of models even more skeptic. So our main problems here are that the traditional systems have two shortcomings, one of them being that not everyone who is sick goes to the doctor, so many of the flu cases tend to go unreported. The other being it is pretty slow, so there's a lag of about 2 weeks. The outbreaks themselves are a problem. The seasonal flu kills up to a little over 500,000 people each year, and it always places a very significant burden on our healthcare systems. There's also the question of the motivation. That means that not everyone who is looking for flu-related information online is actually infected, particularly if we're looking at this pandemic setting. So the main goals in this thesis are that 1, see if we can use online behavior as a reliable proxy for offline behavior in a flu pandemic setting, and 2, if we can distinguish which of that online behavior is driven by infection or is made by people that are actually sick, and which one is driven by other factors such as fear. Now jumping into the methodology, we have datasets from the search trends from Google Trends. These are flu-related search queries indexes. This means that we don't actually have absolute counts. We have normalized trends for each country. They were normalized in relation to a baseline of search activity. And we have that for the US and for Germany, and we are studying these two countries in parallel. We also have the search trends from the Wikipedia page view counts for the US. And as explanatory variables, we have the media activity. These are the new counts for each country. The flu activity. These are the counts of lab-confirmed cases. And we have flu-related anxiety and risk perception. For this, we have survey answers, and they are actually from 9 countries and not only from the US and Germany. Okay, here we can see there's a spike in the news counts in the early beginning of the pandemic in both countries, and the spike of the actual cases is only much later, also visible here in red in both countries. So to better understand all of this data, we used hierarchical and fuzzy clustering. This clustering was made with time as a measure of similarity, and then we used linear regression, Pierce's analysis, and Gregor causality tests. Here we have the clusters. We have two clusters, the C1 and the C2, and when we join all of these analyses, we see that the C1 is strongly linearly related to the flu activity and also proximate with the risk perception, and on the other end, C2 is strongly linearly related to the media activity and proximate with anxiety. Before jumping into the conclusions, it's important to remember that Google provides only normalized trends, not absolute counts, and that Wikipedia does not offer geolocated data. It's also unlikely that the Wikipedia data is completely independent from Google's. But regardless of that, we can see that the limitations of search trend online-based surveillance models can be overcome if we pinpoint the motives behind them. Also, our findings support the use of online data to understand real-life behaviors, even in non-health settings. To further these studies, we should keep and extend this analysis to other countries and other public health crises. It would also be interesting to apply that to COVID, for example. And I hope you enjoyed my presentation. Thank you.